Hello and welcome to ILTV's Insider. I'm your host, Editor-in-Chief Mayan Hoffman. The Gaza War isn't just a threat to our soldiers and hostages for the obvious reasons. It's a looming health crisis. The first polio cases have emerged in Gaza, raising alarms that the virus could spread to our troops, captives, and beyond. Diseases like polio know no borders. Unvaccinated children across Israel could be at risk. To discuss this issue today, I have with me three Israeli public health experts. Please welcome Professor Nadav Davidovitch, an epidemiologist and public health physician. He serves as the director of the School of Public Health at Ben-Gurion University of the Negev and chair of the health policy program for the Taub Center. Welcome.
Thank you for having us.
Of course. In addition, we have Professor Itamar Grotto, a public health physician and professor of epidemiology. He was the Israeli Health Ministry's Director of Public Health Services for 10 years, and most recently served as its Associate Director General from 2017 to 2021. He's also a former member of the Executive Board of the World Health Organization. Welcome.
Thank you and good evening.
And finally, on Zoom, we are fortunate to have Professor Dorit Nitzan, Director of the Master's Program in Emergency Medicine at the School of Public Health at BGU, as well as the chair of its Food Systems One Health and Resilience Program. Dorit is the former Regional Emergency Director for WHO. Welcome, Dorit.
Hello.
On Sunday, Kogat delivered enough polio vaccines through the Kerem Shalom crossing to inoculate 1.2 million people and is coordinating a vaccination campaign with humanitarian pauses. Professor Grotto, how did polio enter Gaza when there was a 99% vaccination rate before October 7th? Is the spread of infectious diseases common in wars? Why or why not?
Well, we see recently a few outbreaks of the vaccine-associated polio type 2, which was a worldwide phenomenon. We also had a case in Israel, and also was identified in the sewage in Israel before, and even in the sewage of UK and the US and New York. So currently we have this type of virus circulating in Gaza.
And is this something that we expect to see during times of war? I mean, you mentioned it was everywhere else that there weren't wars, but I understand that in times of war this is more common.
Well, I think it's some kind of few things that come together into some kind of a perfect storm, because we have here the lower vaccination rate among the children, we have the humanitarian situation and all the sanitary issues, and we have the circulating virus in this neighborhood, let's say, because it's been appearing in Israel, in other countries as well in the area, in Egypt as well. So this is actually, it could be expected since the deterioration of the humanitarian situation, the sanitary situation in Gaza.
Sure, that makes sense. And I know that the vaccination dropped from that 99% to around 90% at the end of the beginning of this year, simply because of the lack of vaccinations, which we're now putting into Gaza.
Yeah, but anyway, it's not related to vaccine coverage, because this type 2 vaccine actually it's not included in the current vaccination, the overall vaccine, because we give only the 1 and 3, which is the bivalent or OPV, which is this is what is given in Gaza and also in Israel. So actually, type 2 is not covered anyway.
Interesting. So now, polio right now is the main concern, but there are other infectious diseases in Gaza that we should really be watching for. Professor Nitzan, can you discuss how damaged sewage infrastructure increases the risk of bacterial and fungal contamination, the potential health impact of animals moving into abandoned homes? What kind of disease disaster could we be facing 11 months into this war, not just in Gaza, but equally as important here in Israel?
Yes, so wars and conflicts, as well as other emergencies, are actually fertile grounds for other emergencies, and they come hand in hand. In many countries, we see the polio outbreaks, but also vaccine-derived polio outbreaks, because this virus, as well as others, are just waiting for some areas of, as Professor Grotto said, with poor sanitation, no access to safe water and hygiene, also crowded living conditions, lack and actually collapse of health systems, including vaccinations, but not only. All of these together create the fertile grounds for so many diseases. Some of them are infectious and some are from other hazards, and some are actually occurring only in humans, but many are moving from the animals to humans and vice versa. So we see it in many countries in the world that are experiencing wars and conflicts. We see it in the Democratic Republic of Congo, in Angola, in Sudan, in Ethiopia, and of course, Pakistan, Afghanistan, many other countries are suffering. We rarely have a developed country involved in war, only lately with Ukraine, Russia, and we see there that the good health systems that were established before the war, and especially here in Israel, where we have very good public health system, very good clinical system, and primary health care, this should be addressed earlier. And I know for sure that the authorities in Israel are taking care to prepare, asking the population to keep with the calendar, with the vaccination calendar, keep good hygiene and practices, and that would help us. The issue is that the collapse of systems together with the other hazards create a petri dish for diseases.
Now, Israel is at war with Hamas, and thousands of civilians, not terrorists only, actually entered Israel on October 7th and slaughtered many of our people. There are still 109 hostages in Gaza, and the Red Cross has not been allowed to visit them. The Red Cross has not been allowed to distribute the much-needed medication that we've tried to send to them. Yet we're facilitating this life-saving vaccination campaign for the children of Gaza. Professor Davidovitch, why is Israel doing this despite the conflict?
I think this is exactly our strength. Of course, all of us were horrified and so angry, even want of revenge, and these are very natural feelings. But our strength is a still democratic country with a very strong public health system, as Professor Dorit Nitzan said, is to see that both on humanitarian but also moral standing, we are taking care not just of our population, but understanding what's going on in our region. And even from utilitarian perspective, finally, as you started, the viruses knows no borders. So there is a danger that this will be finally introduced also into Israel. I must say that we sent a letter already in the first week of the war talking about the sanitary conditions, the need of keeping the infrastructure and water. And although there were some horrible suggestions that maybe epidemics can help us to fight the war, I think that both from moral standing, but also even from an Israeli strategic perspective, this is a very stupid and horrifying idea. So I think it's just strengthening us. Of course, we need to condemn the situation with the hostages. And by the way, they are also exposed to these conditions, including polio. So finally, public health can serve also as a bridge, especially if you're thinking about the day after. We're in touch with the World Health Organization from the beginning, with UNICEF and other organizations. And this is something that, for us as public health physicians, is even a basic fundamental value that we need to keep.
It makes sense. And you and also Professor Nitzan have both alluded to the fact that that these viruses know no bounds, whether it's polio or it's other infectious diseases. So, I mean, Professor Grotto, maybe you can address that a little bit more in depth. I mean, how serious is the risk of this polio spreading to unvaccinated Israelis, especially among soldiers or hostages, as Professor Davidovitch alluded to, but also maybe to some of the vulnerable population, like the ultra-Orthodox, where there might not be as many vaccinated children?
First of all, I will start with the fact that we had actually two historical events. In 1982, when we had a large outbreak of poliomyelitis with a lot of paralyzed children and also adults. And in 2013, when we only identified the virus in the sewage and eradicated the virus with a successful vaccination campaign. So this is actually could be the third time or something. We have this route that's coming. The virus is coming from the south, from Egypt, through the many of the times through south of Israel or through Gaza, and then it can get to Israel. So it happened twice in the past before. So this is something that we have to take into account. Although this is a virus which is a little bit let's say, not so strong because it's vaccine associated, it's not the wild type. So this, as far as the population, we know that, first of all, I must say that it's not specifically the ultra-Orthodox which are not getting vaccinated, because there are a lot of ultra-Orthodox who are vaccinated 95 and 100% in some of the settlements. So it's not something, but still there are some populations, and especially because of the war in Israel after October 7, we see a drop in the vaccination level, not because of people are not willing to vaccinate, but because the access to the health system is less, especially in the people who left their homes.
Right, people who are
this is actually a real threat, because the vaccination rate is dropping down, and here the threat of the polio is going up.
It's interesting. It's a very important point which you made, which is that the displaced people from the north and from the south wouldn't have access necessarily to their normal doctors, even though we have a public health system, and therefore might have reduced the amount of vaccination. Now, Professor Davidovitch, I want to turn to you again, because I'm hoping that you can explain some of the public health risks of the polio virus, both in Gaza and to Israel. What are the symptoms? I mean, I understood that most people that get polio don't even know they have it.
Right. So, like many other viruses, you have the majority of the population, more than 90%, that either will be asymptomatic or suffer from a gastrointestinal, relatively mild disease. Less than 1% can have neurological symptoms. It can lead also to paralysis and even death. This is why we understand that having this one case in Gaza, it's probably the tip of the iceberg. So you continue to have a circulation of the virus, but apart from these few cases, we must understand that the global interest is because polio was decided in 1988 to be the second disease ever after smallpox to be eradicated. The first year of target was 2000, now we're 2024. And what happened that in one hand, it took a lot of time, but more than 99% of cases dropped down. And now we are in a state where there are more cases developing from vaccine-derived polio than the wild type. On the other hand, it is clear, and this is in contrast to what some of the anti-vaccination people are saying, we must use vaccines. In Israel, we are using a combination of IPV, the killed virus, and OPV. In Gaza, it will be just what is called the novel OPV. And this is the only way to see how it's going to be eradicated, but vaccines are not enough. We must take care also of the sanitary condition, other social determinants of health. And as you said before, the vulnerable population, then we're talking about infants, we're talking about people with a chronic condition that the immune system is weakened. We must have a very massive campaign. Vaccines are by UNICEF and WHO already to be distributed, and we called for a local ceasefire, like it was called in Afghanistan, in Syria, Sudan, and other places, in order not to endanger the healthcare teams. This is not something political. This is something that all over the world was demanded. We sent a letter
and by we,
that all of us were assigned, the public health experts, asking the Minister of Defense and the Prime Minister to see how they're going to be an effective campaign. And again, this is also our interest.
And let me actually continue with you on that for just a moment, because we've identified 100% one case. As you mentioned, it was a 10-month-old baby. I understand that one of her legs were paralyzed. But there might be many more cases. And in a time of war, surveillance, for example, would also be hindered. And I assume also distribution. So just in very brief, what would be the major challenges in both surveillance and distribution with this current campaign? And do you even think that with all those vaccines going in, we're going to be able to get them to the right people?
Okay, so you mentioned surveillance and vaccination. So there is the sewage surveillance. In Israel, actually, we are one of the best countries doing it. By the way, during the COVID pandemic, surveillance was much better. There was a cut in the budget, and in our last meeting, we asked that there be much more coverage in terms of sewage surveillance. So this is one thing taking place also in Gaza, but it's not enough.
So we assume there are more cases than the one that was identified?
Right. There were 7, as you mentioned, 7 samples were sent, 6 were positive. But there's also the clinical surveillance, and there's what we call the acute flaccid paralysis, being caused by many different viruses. And this is one of the indicators to see that surveillance is good, because usually there is a certain percentage there, and then you need to check and see if this is polio or not. And we know that this kind of clinical surveillance is almost impossible now in Gaza, because the system is almost non-existent and fragmented.
And then with regards to distribution, do we...
And regarding the vaccination distribution, we must have a certain assurance, a ceasefire, again, just for doing the vaccination in different local places, so people can get the vaccine. This is extremely important, and again, it's also our interest.
And I understand from the release that COGAT put out, the statements that they're saying is that these ceasefires are actually going to be orchestrated in order to deliver the vaccines. Now, I want to turn back to you again, Professor Nitzan, if I can, to think about the idea that there might be not only more cases, as we mentioned, but that the Israeli Society for Infectious Diseases is calling for those ceasefires, and there is some international precedent for that. Professor Davidovitch touched on what some of those are. Can you give me one or more concrete example of where that was in place and we know that it actually worked?
Well, in many places where we had outbreaks and experienced outbreaks, including polio, we had some ceasefires, some corridor, what we call safe corridors of health workforce and vaccines. It happened in many countries, including Syria, Iraq, Ethiopia, Sudan, and many, many others. We must ensure the safety of the health workforce and the families, the children that are brought to be vaccinated. Otherwise, nothing will work and we will fail. The whole idea of these mass vaccination campaigns that are coming at once, they must cover at short time maximum of the amount of the children that need to be vaccinated. All those children that have been behind in the past 10 months need to be vaccinated. And therefore, it's important to keep those rules and not to allow any warfare or any activities to be in the area, just to let them get vaccinated peacefully.
And we assume that those children who are lacking the vaccination in the last 10 months are children that potentially were born after October 7th, or right before. Would that be reasonable to assume?
Yeah, exactly. We know that, as you mentioned, that the vaccination rate in Gaza and the West Bank had been very high in the past years. And this is due to lots of work that has been done between Israel and the Palestinian authorities with the OPT. But what we know is that since October 7th, the health system has been collapsing there. Only some children got vaccinated and had access to vaccines. Our kids, the kids that were kidnapped into Gaza, the babies, are not vaccinated as well.
So we're talking about the Bibas children, of course.
Exactly, the Bibas children, they have not been vaccinated as well. And therefore, when we ask and we beg, let them also be vaccinated. We need all infants to get the vaccination at this time.
And now I'm going to ask you for just a 1-minute answer on this, but we're also vaccinating our soldiers. We launched a vaccination campaign for the soldiers recently. Your own husband actually is working at the health ministry and is overseeing that process in some capacity. Can you just give me an update on how is that going, and are the soldiers actually being vaccinated?
The soldiers are being vaccinated, and also health care workforce have been vaccinated routinely. And in Israel, just to let us all know, we are getting vaccinated not only with the oral polio, that yes, indeed, it doesn't include the type 2 there, but we also have the injection type, what we call the dead virus, which includes all types. So if we get vaccinated, all of us, if the families that are awaiting our soldiers to come back home, are all getting vaccinated and are on this schedule, our kids will be protected.
Great. Now we're going to run out of time, so I just want to ask one more question for each of you to answer, if you can really keep your answers as tight as possible. But the last question is this: what is the most critical public health measure that should be taken immediately to prevent a full-blown polio outbreak in the region? Professor Grotto, you start.
According to our experience in 2013, the only way to cut the circulation of the virus would be with the oral vaccine, with the new vaccine, which would be given to at least 80 to 90% of the children of Gaza aged 0 to 10. So it's about 600,000 children with 2 vaccines. This is what should be done in order to prevent the disease from continuing circulating, not only in this area, but also globally.
Professor Davidovitch, do you agree?
I totally agree, but I must say that this is what we call in public health a very vertical approach. Mm-hmm. Polio is not alone. There are so many other things. And finally, of course, we need to do all of that, but we must take care of what we call the social determinants of health, the sanitary aspects, and thinking about the day after. Otherwise, now it's polio, then it will be something else, and we're not going to get from this vicious circle.
100%. And Professor Nitzan, if you could just in 10 seconds tell me, do you agree with these two professors, or do you have something else that you'd want to add?
I absolutely agree with my two friends, and I just want to add that polio, we are all thinking and getting scared by it, but measles and other vaccine-dependent kind of or repellent diseases will come, and they are there. So we must continue with all the child vaccination program, with the agenda fully. And as Nadav, as Professor Davidovitch said, we need to address the water sanitation and hygiene, and other determinants. This will not go away otherwise.
Thank you so much. That is unfortunately all the time that we have this evening. I really want to thank our guests for being here. For more of the latest updates from Israel, make sure to subscribe to our newsletter at ILTV.tv. You can also purchase and download our app to receive alerts directly to your phone. Thanks for watching Insider. Stay healthy. Let's win this war and bring our hostages home.